starting point and the finishing point, that all of us, men and women, we get the government that we elect, and then it's up to us in elected office to take it from there. But the things that matter to politicians are the things that matter to the people we represent. I think very often when we think about politics, we think about a pretty superficial kind of politics. We think of what I call the sport of politics, the little gotcha moments. But for me, politics is about getting things done, about driving the kind of change that the people, certainly my constituents, talk to me about. But what I thought I'd do is get started. You've all introduced yourselves. I'm going to introduce myself. You know I'm the Minister of Health and Long-Term Care. You might know I'm the MPP from London North Centre. But like everybody, I'm really mostly my family. That's what is at my core. That is what is most important to me. This is a picture that was taken a year ago, almost exactly a year ago, last summer. It was the wedding, you might tell, of my daughter, Christy. She's the one in the white dress. It's her. To her right is my youngest son, Tim. To her left is her new husband, Mark. They have since had a baby. Beside Mark is my daughter, Toby, and she is holding my eldest grandson, Isaac. Isaac is sound asleep. He fell asleep during the service and would not wake up for the pictures. So all the pictures we have are of him sound asleep. There are some people who should be in that picture who are not in that picture. Toby's husband, Rock, isn't in that picture because he is at home with the two other people who should be in that picture. They are brand new baby twins, 2 weeks old. So 2 weeks before this picture was taken, my daughter Toby gave birth to twins. They had just come home from the neonatal intensive care unit 2 weeks before the wedding, so her husband said, "You go to your sister's wedding, I'm staying home with the babies." So that's my family. Those little babies are doing just fine. They have celebrated their first birthday now, and as you can see, they are healthy as can be. So that is Thomas and Annie and Isaac. Those are my three eldest grandchildren. They inspire me. When I look at them and see the enormous potential within those little people, that is what drives me. Because as a grandmother, of course, I want what's best for them. As a minister in the government, I want what's best for all children. And that really does drive me. When I see how children respond to whatever supports are available to them, I just see the world of potential, and I see it's our collective responsibility to actually be there for them, be there for all children, no matter what kind of circumstances they are born into or they arrive here in Canada with. It is our job to provide them with everything they need to be the very best they can be, and that is really really what I care about. Now, I talked a little bit about how women are underrepresented at Queen's Park. We're only 26% of our caucus is made up of women, but you might be interested to know that we spend 80% of the money. So we exercise our power, our authority in a different way because we are women. I think it's fair to say that 80% of the money you spend on taxes is spent by women. I think that's pretty impressive. You know, we are in the positions we are because we've been given that opportunity by Prince, and he has recognized. I like to think he's recognized the talent, and he's given us the opportunity to put that talent to work. You know, I can say that that our women's caucus meets regularly. There was no women's caucus prior to the 2003 election. Enough of us were elected in 2003. We thought it might be helpful to form a caucus where we actually hammer out some pretty difficult issues. And then what happens, I should tell you, by the way, that men are welcome to come to our women's caucus. They just have to understand that we maybe conduct ourselves a little bit differently than they might expect. We tend to talk a lot. But what we do is we actually talk about issues that matter to us, matter to our community, and issues that sometimes don't show up in public opinion polls, but issues that we see in our ridings. And although I have to tell you, when we started to meet, we said we don't want to fall into the stereotypical women's issues. We want to talk about other issues that are important to women. But when we really started to do our work, we found where the areas where we thought the most opportunity did tend to fall into those stereotypical women's issues about kids, about seniors, about opportunities for women. So that is where we have focused our energy. So we have our meetings, we develop our plan, and then we go to our other caucus members and try to generate support for our ideas. One of the things we have been enormously supportive of is full-day kindergarten. And I think that full-day kindergarten is really the greatest improvement in our education system in a generation. It is making an extraordinary difference for children and for families. We now have 35,000 kids have just completed the first year of full-day kindergarten. In the fall, 50,000 kids. And by 2014, we will have all kids in the province with the opportunity of full-day kindergarten. It is turning out to be a wonderful success. We now have 1 full year under our belt, and we are seeing the results, and the results are absolutely clear. I visited a classroom in my community. I was there at the end of February, and this picture was taken when I was visiting that classroom. This mom told me that's her little gorgeous daughter. That's the eldest of 3 children that she has. She could not tell me enough about the difference it was making in her family and to her child. She said, the money they are saving is enormous. She said, you're saving me $600 a month in childcare. You are making it possible for me to actually go out and work. She said, the stress that you are saving our family is fantastic, because every day is the same. It's saving families time, it's saving families money, it's saving families stress. Because when you've got kids in school, alternate days or half days, it's very hard on families that pick up and the delivery and that noontime shuffle, or what day is it, where are we going. Kids love that continuity. The teacher in that classroom told me, she said, I've been teaching for 25 years. And I have to tell you, when I heard you guys were talking about full-day kindergarten, I was not so sure that this was a great idea. I wasn't sure the kids could handle it. She said, now I'm the biggest fan there is. I am a complete believer in full-day kindergarten. The kids have demonstrated they are rising to the occasion. She was very proud to tell me that her kids, by the end of February, were where she would have expected them to be by the end of June. They were really responding to that play-based learning. They were doing extremely well. She said, you know who's going to have trouble? Are the grade 1 teachers. Once they get these kids in their classroom, they're going to have to totally rethink the way they teach. So our kids are responding. It is turning out to be a wonderful, wonderful change. And the kids who benefit the most, every child benefits from full-day kindergarten. The kids who are benefiting the most are the kids who are growing up in homes that are facing some challenges, because they are the ones who would have come into grade 1 already behind. So they are getting up to speed. They're also being able to identify learning disabilities and problems much earlier. So there's a whole lot of reasons that we're really proud of full-day kindergarten. Not everybody thought it was a good idea, but we absolutely believed in it and are absolutely committed to rolling it out right across the province in every school in this province. Another area when it comes to education that we are enormously proud of is our accomplishments when it comes to high school graduation rates. Now, when we took office in 2003, high school graduation rates were a shameful, I would say, 68%. 1 out of every 3 students did not graduate from high school. And you know what the future holds for someone who doesn't even have a high school graduation diploma. The future is not bright at all. We have been able to raise that graduation rate, and we are now at 81%. So from 68% to 81% is a remarkable achievement in just 8 years. Our teachers have been full partners in this. We have supported the teachers through a range of different programs, including high skills majors, which are really keeping kids in school who would have left otherwise. It's a remarkable success. People are coming from around the world to understand what's happened in Ontario. How did you do it? What happened? They see it as a miracle, the Ontario miracle, they call it. So we're at 81%, but we're not satisfied. We want to do more. We set a target of 85% of kids graduating from high school. And I know that when we get to 85, we're not going to be satisfied with that either, because we'll still look at those 15% and say, what more do we need to do to keep those kids in school? So we're pleased with that. We're proud of that accomplishment. The other, when you've got that many more students graduating from high school, and when today's economy and certainly tomorrow's economy demands a high level of post-secondary education, we've really invested in post-secondary education in our colleges, in our universities, and in apprenticeship spots, because that post-secondary education, regardless of what form it takes, really is the ticket to success for our kids. So we've added 200,000 spots in our post-secondary institutions and apprenticeships, but we're just committed to adding another 60,000. We really do believe that if we make the right investments today in our young people, that will benefit all of us, because they will be able to work at a high level of productivity that will support all of us as we age. So we're a real believer in post-secondary education. Jim mentioned poverty reduction. I have to tell you that poverty reduction was not a campaign platform when we ran for office, but Women's Caucus insisted that we focus our attention on poverty reduction, because we just could not bear to sit back in positions of responsibility and not take action on poverty reduction. I was enormously honored when the Premier asked me to head up our poverty reduction, our first poverty reduction strategy. I did province-wide consultations. Jim was a wonderful supporter of our work on poverty reduction. You can imagine it's such a big topic and such an important topic and such a range of opinions and solutions that were offered in consultations. And what we, at the end, decided we had to do is we had to start somewhere. When you're taking on something that big, you can't do it all at once. You have to do it step by step. So we decided to start with children, because we know that children who are growing up in poverty are far more likely to repeat the cycle of poverty than other kids. So we called our first 5-year strategy Breaking the Cycle. And it's about breaking the cycle of poverty, giving kids growing up in poverty the opportunity to be successful. At the core of that is education. The greatest protective factor we can provide a child is an education. So really focusing our attention and getting kids who are growing up in low-income communities everything they need to be successful in school. So we call our strategy Breaking the Cycle. It's focused on kids, but we also have passed in legislation the requirement of any future government to every 5 years renew the poverty reduction strategy, to do a new series of consultations, to develop new targets and new measures of success when it comes to poverty reduction. I was enormously pleased to see the Statistics Canada report that came out recently that showed us that even though we are coming through the worst recession in our lifetime, we actually have reduced the number of children living in poverty by several. I think it's 17,000 fewer kids living in poverty now, thanks to the initiatives that we have made on our poverty reduction strategy. So our poverty reduction rate has declined. In contrast, Alberta's poverty reduction, or child poverty rate, has gone up by 25% through this recession. So it demonstrated that with the right investments, we really can drive change. And it was the women in our caucus that really drove poverty reduction to the top of the agenda. One of the things that was part of our poverty reduction strategy was the Ontario Child Benefit. Now the Ontario Child Benefit is cash, because people in poverty told me loud and clear, what we need is more cash. More money is what we need. That would be the greatest help. So we actually brought in the Ontario Child Benefit. Over $1 billion every year goes into the pockets of low-income families to help support the kids. The Ontario Child Benefit now is $93 per child per month. That's, I think of $93 per child per month as a grocery cart full of groceries that they would not have had before. It's also restructured our social assistance system so that families who are trying to move from social assistance to employment actually can keep the Ontario Child Benefit to make that transition from social assistance to employment a lot more smooth than it was. But the Ontario Child Benefit was just one part of our poverty reduction strategy. And I want, if you will, just imagine a single mom with a couple of kids working a minimum wage job full-time. So that woman, when we took office in 2003, her income would have been far below the poverty line. In fact, she probably would have been better off on social assistance than working that minimum wage job, because it just didn't pay enough, and the way the benefits were structured, she was actually better on social assistance. Fast forward 8 years later, her income has gone up by 54%, more than $10,000 more in her budget to spend supporting her kids. Her income is now above the poverty line. I want to say she's not in the lap of luxury. She's still working hard to make ends meet, but the reality is she doesn't have to move. She can pay her rent and she can feed her kids. So we've come a long way on poverty reduction, but we are determined to keep on going, because there are still far too many kids who are growing up without enough to eat, without stable housing, with parents under real stress. And we also know that poverty is not limited to children. So as we develop the next 5-year poverty reduction strategy, we're going to be back for another round of consultations on where do we go next. Do we do more on children? Do we focus on seniors? Do we focus on people with disabilities? Where do we go next? What are the next measures? What are the next initiatives? We've been able to demonstrate progress. We're about halfway through our first 5 years. We've been able to demonstrate real progress despite the economy, but we know there is so much more to do, and we are absolutely determined to do it. Another area that I just want to touch on, I think women, no matter what their income, we really do like to drive a good bargain. It is part of what we do, and we like to squeeze all the value we can out of every dollar we spend. And I can tell you, when I became Minister of Health, not even 2 years ago, I became aware about how much more we were paying in Ontario for generic drugs than they were right across the border. It was astonishing to me that we were paying so much more for generic drugs than people in other jurisdictions. So I brought in some changes. I was able to cut the price of generic drugs in half, and not just for government, but for everybody. If you pay cash for your drugs, the prices have come down. If you get your drugs through a benefit plan, the price of those drugs has come down. So we've been able to reduce the price of drugs, cut the generic drugs in half. That saves our government $500 million every year. $500 million, I tell you, I can find much better use for than what it was, where it was going before. So that $500 million we have put right back into better health care. We're paying pharmacists to do the kind of work that they are trained to do. We know that the future of health care requires that we all work together. So we need our pharmacists being part of our healthcare team, and we are now paying them to help us more and more with drug-related issues, you can now go into pharmacies and have the pharmacist review your medication. So if you're a senior on many different drugs, you can actually, and often those drugs come from different specialists, right? So you can sit down with the pharmacist, they will go through all the drugs you're taking, make sure you're that you're taking them at the right time, that the right combination of drugs are there. And more often than not, what the pharmacist finds out is that maybe you're taking more drugs than you need to be taking. And that pharmacist will work with the doctors to adjust your medication to make sure you're getting the best for the drugs that you're taking. So better pharmacy services. We're also investing in better health care, more community health centers, more MRIs, more doctors, more nurses. We are determined to continue to improve the quality of healthcare and the accessibility of healthcare in this province. So we're really determined to improve access. When we came to office in 2003, people were desperate and they were looking for primary health care, for a family doctor. Absolutely desperate to find a family doctor. We've made important investments. We're now at 94% of Ontarians do have a family doctor or a nurse practitioner, 94%, but we're not satisfied with that. We think everybody in Ontario should have a family doctor because that good primary care is such an important part of health care. So we've got 2,900 more doctors working in Ontario, 1.3 million more Ontarians with a family doctor. But as I say, we're not satisfied. There are some parts of the province now where we actually have doctors looking for patients. That never would have happened 8 years ago, but we still have parts of the province where people are really working, desperate still to find family doctors. Up in northeastern Ontario, for example, only 85% of people there have family doctors, so we're making more investments there to bring more primary care to the parts of the province that really need it. You know, we've created a lot of different healthcare options for people, and in fact so many so that we thought it was time to take a step back, that we were moving quickly, and it was time to make sure that people of Ontario knew what was there for them. So we created a new website. It's called Healthcare Options, and I thought I would just take a couple of minutes to highlight some of the wealth of information that is on this website.